It's Amy Klingler from the Salmon River Clinic in Stanley, Idaho, back again to talk about tools and resources for patients with Alzheimer's disease. This includes tools for PAs, for patients, and for their care partners. It's really important to have the conversations when you're sending your patients off to specialists. For PAs who are taking care of patients with Alzheimer's disease and mild cognitive impairment, there's lots of ways that we can improve our practices and streamline our workflows. The first that I really think is important is making sure to try to read chart notes before you sit down with your patient, especially if they're coming back to you after being seen by a geriatrician, by a neurologist, or having had some diagnostic imaging or testing. So if you have all of that information fresh in your brain, you can sit down with your patients, you can answer their questions, and you can identify gaps in their care. You can identify where they need the most support and where their care partners need the most support. This will help you and help your patients. For patients, you want to make sure you're getting them in touch with the resources they need in their communities to address what they're looking for out of their care. Some patients are really concerned, especially in the early stages of Alzheimer's disease, about maintaining their independence. So do you need to connect them with Meals on Wheels? Do you need to connect them with perhaps transportation assistance, some other community organizations that might help get them out socially and maintain their physical activity as well? In this phase, care partners are really important, and I try to provide as much support to a care partner as I do to a patient, because they're the ones who are really managing the burden of this disease, especially in the later stages when the patients are less aware of the impact the disease is having on their cognition and their functional capacity. So care partners need help. They need support in the community, and they need support from you. Thank you for tuning into this video series. It's really been an honor to share this information with you and to realize the importance and the impact that we as primary care providers can have on our patients and their care partners as they navigate mild cognitive impairment and Alzheimer's disease.